Hi, I am Dr. Bindu Menon. Welcome to our project EduWAND. EduWAND means Educating Women About Neurological Diseases. Today we are going to talk about stroke in women and hypertension as a risk factor for stroke in women. There is a misconception that hypertension is not as common in women as in men. In fact, half of the people who are diagnosed with hypertension, half of them are women who have hypertension. Now, what are the various risk factors that women are at risk of getting hypertension? One is their menopausal age itself, that puts them at risk of getting hypertension. Women who gain around 10 kilos of body weight tend to have a risk factor of getting hypertension. Then there is a family history of hypertension. In fact, that is common for both genders. If one or two members in the family have hypertension, then any individual in the family has almost a 50% risk of developing hypertension itself. Some other risk factors which are very common to women only is one is the pregnancy-induced hypertension. That is, during pregnancy, some women tend to develop hypertension which gets resolved, but then later in their life they tend to develop hypertension again. So it is mandatory and imperative that they keep a track of the blood pressure on and off. Second is use of oral contraceptive pills with estrogen content, over-the-counter medications. That is, they go to the pharmacy and they take those pills, and there is a chronic use of these estrogen in their blood at levels which is putting them at risk for hypertension. So it is again important that they should connect to their gynecologist and take the proper doses of medications for the proper duration. Then women who have a history of migraine with aura have been found to have stroke in general, which is more common in them. These women have also been found to have hypertension. Some other risk factors which women feel that they are not probably having it, like that is obesity, history of PCOD, that is polycystic ovarian disease, which is again linked to obesity in them, history of lack of exercise. In fact, women feel that if they are working at home, that is enough for them and they do not need to have particular exercise form in them, and that again is a misconception that puts them at risk for that. In general, women have to, in fact most of the women are working nowadays, so they have to balance their family and work life, and there is a lot of tussle in that state and puts them at risk for depression and anxiety as well, which is again a risk factor for developing hypertension. So women, kindly check your blood pressure today and get it checked at any clinic in a proper manner. And if it is high, that is if it is standing at 140, then consult your doctor to see what modality of treatment you may require. Follow our EduWAND, EduWAND page for more updates. Thank you.